Senator Cordy.
Thank you, Speaker. My question is for Senator Gold. And Senator Gold, as we enter cold and flu season, on top of the increasing COVID numbers that we're seeing, families are experiencing an alarming rise in children's illnesses across the country. The Children's Hospital of Eastern Ontario here in Ottawa has reported that between the months of May until September, the hospital saw the busiest months in the organization's 50-year history. Officials with the hospital are pointing to a surge in flu and COVID-19 cases. They've seen about 10 times more patients with respiratory syncytial virus, or RSV, now than before the pandemic. The virus, which disproportionately affects small children, features symptoms including a fever, runny nose, coughing, and can lead to difficulty breathing. As parents try to alleviate these symptoms for their children with the medications from the local pharmacy, they are often finding empty shelves. Last week, Health Canada released a statement recognizing the shortage of infant and children's and acetaminophen and ibuprofen, but gave little to no detail about how they plan to address this situation. Health Canada says the shortages are because of an increase in demand, but shelves have been empty for months, Senator Gold. So my question is, why are the shelves empty? And Senator Gold, could you provide us with details on how Health Canada plans to increase supply of these much-needed products and get them to families who most need them?
Senator Gold.
Thank you for your question and for raising a very preoccupying situation for families across the country. And the government shares the concerns of many parents and caregivers about their families and their inability to find pediatric analgesics, such as you mentioned. I'm advised that Minister Duclos and Health Canada have spoken to several manufacturers, including Johnson & Johnson, Haleon, and Pharmascience, to reiterate the urgent need to collaborate to find immediate solutions to this shortage so that parents and caregivers can have the medicines they need to take care of their children. Companies that supply Canada have also been provided pathways to import foreign products, and the government is reaching out to additional suppliers to attempt to fill the gap. Health Canada has issued a public advisory offering parents and caregivers advice and important safety information, and as the health and safety of children remain the government's top priority, all options to solve this shortage are on the table.
Senator Cordy, supplementary.
Yes, thank you, Speaker. And thank you, Senator Gold. And I'm very pleased to hear that Minister Duclos is speaking to manufacturers and that they are looking for other producers for this type of medication for families. Now, the assumption would be that these products would be very similar to the demand of the same products south of the border. But anecdotal evidence, and that's people telling stories to the media, from families who have been to the United States report that they're not seeing the same empty shelves in the U.S. as we're seeing here in Canada. So what is the reason for the drastic shortage of infant and children's products in Canada, and what are the barriers that are specific to Canada and Canadian distributors which are preventing these products from getting to Canadian shelves? And I guess my question is, what will Health Canada do to ease these barriers so that we'll have products? And I am really pleased that you told us earlier that Minister Duclos is speaking to providers, but it seems that if we're having shortages in Canada, very often it's reflected in the United States or the reverse, but that doesn't seem to be the case. And is there a reason for that? And if there is, can we work at finding solutions?
Senator Gold.
No, well, thank you for the supplementary question. I don't know the answer why, at least anecdotally, there appears to be less of a shortage south of the border than here. My understanding is that Dr. Supriya Sharma, the Chief Medical Advisor of Health Canada, is of the view, and it's confirmed indeed, that the drug shortage is expected to be resolved soon, as manufacturers of these analgesics have significantly increased their production to meet domestic demand. And And I understand that, as I mentioned before, the minister has recently spoken with a number of manufacturers who are committed to maintaining their increased production capacity over the coming months. Now, there is, and I don't want to speculate, that's not helpful, but we do have labeling requirements in Canada, and I'm told that in that regard, if that is in fact one limiting factor for medications that come from outside the country, I've been told that work will be done in partnership with providers to add information to the label in both official languages to ensure that patients and caregivers have the information they need to understand the medication they're taking. But I'll make some inquiries, Senator, and be happy to report back.